Good morning, dear students. Myself, Ngawang Chanu. MSc Nursing first year, Department of Community Health Nursing. Today we'll be discussing on assessment of depression. I hope that you all have gained some knowledge regarding depression from the previous class. In the previous class, we have seen what is depression, the definition of depression, the signs and symptoms of depression, presentations of depression, core symptoms of depression, and the depressive diagnosis symptoms for both the major and minor depression, the contributing factors of depression, and why depression is a public health priority. All these topics we have already discussed in the first class. And today we'll be seeing on the assessment, how we are going to assess that the person is having depression. In today's class, we'll be discussing on the use of effective communication skills in interaction with people with depression and the assessment principle of depression and how to perform an assessment for the depressed patient. So first, we'll see how do I know if someone is experiencing depression. That means how we are going to identify, how we are going to know that the person is experiencing depression. In this case, what we have to do is, if we notice some changes in the person's moods, behavior, energy level, habits or personality, we should consider depression as a possible reason for these changes. And the second point is, do not ignore the symptoms you have noticed or assume that they will just go away. Each individual is different and not everyone who is experiencing depression will show the typical signs and symptoms of depression. Many people who experience depression may also be affected by other mental health problems like anxiety or substance use problems. However, do not assume that any signs or symptoms you have noticed means that the person is experiencing depression. In this case, what we mean that if you came to know or if you notice any changes in the person, like your friends, maybe your relatives, your family member itself, if so, or if you notice any changes in their mood, behavior, energy level, habits or personality, that all these things we have already discussed in the previous class, that is behavior, like now they will have loss of interest, and then easy fatigability, pessimism, always thinking negative, and the feeling of helpless, hopeless, worthless. If you see all these changes, you may consider these changes may be because of depression. So you should not ignore such symptoms. You have to try to find out the causes and to help them out, seeking the interventions. You should not simply leave them that the symptoms may go away after some times. And all these symptoms, if present, is also not a confirmatory that the person is suffering from depression. Next is identifying depression. Depression means there is a considerable impairment in a person's ability to function in daily life. Some persons may experience a persistent depressed mood, but they are able to continue functioning in daily life. Therefore, their symptoms do not amount to depression and can be managed. For identifying the depression, their person will have persistent depressed mood, but if he or she can control and can be able to function their life, means she is adjustable, she can manage by herself. So that symptoms doesn't amount to depression, that is under control. When all this affect the daily activities, and then she cannot control by herself, and the feeling of suicidal ideation, that time it may amounts to depression. But unless she can manage by herself, it doesn't amount to depression, even though the symptoms is present. But we have to find out, we have to help them, we have to counsel them, we have to give the hope for living. Next, for the depression, the most important strategy is communication, starting conversation. That's why in this picture you can see depression. Let's talk. When the person is depressed, I have already discussed the sign and symptom. It is there, the social isolation is there, and then pessimism is there, oversleeping, appetite changes, not eating or eating too much, all these things, and he will be silent. All these changes, if you see, you try to start conversation, talk with the person you have noticed, and help them to ventilate their feelings. Until and unless they won't express out their feelings, it is difficult to say that whether the symptom is amount to depression or not. So first, the main and the foremost thing is conversation. Let's talk. We'll see what are the steps we have, how to start the conversation and what strategies to start the conversation. Everyone is confusing. How should I approach them? Because they are already depressed, they are already sad, they are not in the mood to talk with anyone, they are isolated from everyone. And if we start talking also, they won't respond nicely, and they are always thinking negatively. Pessimism is also one of the symptoms. So the normal person, as a layman, they feel very difficult to approach them. How should I approach someone who is experiencing depression? If you think that someone you know may be depressed and need help, you first consider who is the best person to approach them. Ask the person if they are willing to talk to you, or they would rather speak to someone else, or give the person opportunities to talk and try to spend time with the person and gently bring up concerns with them. Example, mention the person seems down today. In this, what it is mean is that if you think someone is depressed or they have some mental problem, you first try to find out who is the best person, who is very close to him, to approach or to start with the conversation. He won't speak out all his feelings, he won't ventilate his feelings to someone who is not very close. Even to the one who is very close also, it is very difficult to ask their feelings, because they are already occupied with their mind and they don't want to share with anyone. That's why they start isolating themselves from the people. So it's a crucial time, it's a crucial period to search, to think who is the best person to approach, and ask whether, if you think you are close enough to that person, you ask whether he or she is willing to talk to you or he want to speak to someone else. And you have to give opportunities to her to talk, to let her express her feelings, and you should be a good listener. So next, for that you need to be a good listener, and you have to make them feel that you are there to help her. You are always there to help her. That time only she will start it slowly saying out their feelings. So we'll see how are you going to be supportive, so that you will let him or her feel that you will be there for her, to ready, or you are always ready to help at her back. Whenever she needs, she will get support from you. We'll see how can I be supportive. How can I be supportive? This is the thing we have to be mainly consider in this. As they started thinking that you are supportive, you will be there for her, always approachable. That time only she will started speaking out. She will feel comfortable. That time only she will started saying his feelings. So the important strategies we have to share here are to treat the person with respect and dignity. When you treat the person with the respect and dignity, she will feel that she is being considered as normal by you and you are ready to help. We already discussed about the respect and dignity in the first class, that is in the introduction of the class. In the respect and dignity, it means that every person is born equal and the violation of this respect and dignity should be avoided. And the points in this for being supportive are offer consistent emotional support and understanding, encourage the person to talk to you, be a good listener, have realistic expectations for the person, acknowledge the person's strength, and it can be helpful to let the person choose the moment to open up. However, if the person does not initiate a conversation with you about how they are feeling, you should say something to them and let the person know that you are concerned about them and are willing to help them. Ask the person if they would like to talk to you about how they are feeling, and if the person says that they are feeling sad or down, you should ask them how long they have been feeling that way and if they have spoken to anyone else about how they are feeling. So here in this case we have to think how I have to talk with her too and how will I understand her problem. Only when I can give some support to him, the person, then only she or he will started speaking out. So you offer consistent emotional support. For example, when the person is having problems like in case of educational status, let's say he is not scoring good marks and so he or she is feeling down, or maybe love affairs, any problems in job or like demotion, promotion. In that case we have to give uh, consistent support is needed. For let's take that education status, that is he or she is not scoring mark and he is feeling depressed. That time, as a friend or a person who can support her, we can say that while we can start asking her problem, and when she say that I am having this problem, I am not scoring mark, you have to be supportive. Consistent support you have to give, like you can do it, this is not the last exam, next exam you study well. If you have any doubt, come forward, we will discuss, we'll study together, I know you can do it. Like this you have to give support, emotional support, and you have to understand her problem, and you have to encourage the person to talk to you, to express her feelings, to ventilate the feelings inside. And you should be a good listener and you should not interfere in between while he was speaking. These are the things which help you to become a supportive, and only you can give such opportunity like maintaining eye contact, offering consistent support, understanding her. That time only the person will open up her mouth and you can start the conversation nicely. And if the person does not start also, you can start it, but you have to maintain privacy and you have to gain the trust. You have to try to gain trust of the person who is depressed. The best way to communicate with someone who has depression is to be a good listener and to use language that is supportive. This is the best way. Keep noted this point. How is the best way to communicate with someone who is depressed? Okay, students, I'll ask this question, so be attentive. And you also can help your colleagues if you know this. The first point is communication is the first point. If you know how to communicate, then only you can start assessing. So first is communication is important. So for approaching the person who is experiencing depression is, first you should be a good listener, right? And next is supportive. You should be very supportive. You have to give support to her, consistent support, emotional support and understanding. Experiencing depression can result in a lack of energy and not being able to sleep, feelings of being overwhelmed, difficulty with concentrating or making decisions, negative thoughts and feelings of worthlessness, withdrawal from people and activities. The general principles of effective communication skills. In this, using effective communication skill allows healthcare provider to deliver quality care to adults, adolescents, and children with mental, neurological, and substance use conditions. So, we'll see the communication tip. The tip number 1, the first one is create an environment that facilitates open communication. Meet the person in a private space if possible. Be welcoming and conduct introduction in a culturally appropriate manner. Maintain eye contact and use body language and facial expression that facilitate trust. Explain that information discussed during the visit will be kept confidential and will not be shared without prior permission. See carefully the tip 1. First is privacy should be maintained. Privacy should be maintained and maintaining eye contact, body language, facial expression that facilitated trust. As I have already told you that trust problem is also one of the important. If you can't trust, how the person will speak out to you? Okay, so first, confidentiality, privacy, trust is important to start a communication. Next is, if carers are present, suggest to speak with person alone except for children and often consent to share clinical information. When interviewing a young woman, consider having another female staff member or carer present. And next is the tip 2. Communication tip 2. Include the person and with their consent, their carers and family in all aspects of assessment and management as much as possible. This includes children, adolescents and older adults. Tip 3. The communication tip 3, that is, should be start by listening. Active listen, be empathic and sensitive, allow the person to speak without interruption. If the history is unclear, be patient and ask for clarification. For children, use language that they can understand. For example, ask about their interests such as toys, friends, school, etc. And for adolescents, convey that you should understand their feelings and situations. See, in the communication tree, it is listening. Start by listening. You should be an active listener and you should be empathetic and sensitive. And you should not interrupt while the person is speaking. We have to let them speak or ventilate their feelings first. And if we see the history is unclear, we should not be very fast. We should be very patient. Be a passionate and active listener and ask for clarification. We will ask whether any problem, any statement which is not clear, we can ask for clarification. We should give time to clarify the situation. And if it is children, we can use their interests, about their interests, toys, friends and school. For the adolescents, mainly for the adolescent, we have to make them feel that we understand their situation and feelings. Communication tip 4. Be friendly, respectful and non-judgmental at all times. Always be respectful. Don't judge people by their behaviors and appearance. Stay calm and patient. Tip 5. Use good verbal communication skills. Use simple language, be clear and concise. Use open-ended questions, summarizing and clarifying statements. Summarize and repeat key points. Allow the person to ask questions about the information provided. In the tip 5, that is good verbal communication. We have to use good verbal communication. And for this, we have to use simple language, easily understandable, and the language should be very clear and concise statement only. And open-ended questions. You should not ask yes or no question. You have to ask open-ended questions while doing this conversation, because you have to give them the chance to express all their feelings. Only that time you can understand, or you can come to know that the exact problem faced by the persons. And summarizing and clarifying the statements. If anything you can't get it clear, you can ask them and you give them time to explain more, so that you will get to know what the problem he or she is suffering. And summarize and repeat the key points. The key points means the word which you feel that may be the cause, which the main cause for the problem. You repeat it, summarize it, and allow the person to ask questions about the information provided. Tip 6. Response with sensitivity when people disclose difficult experiences, that is, sexual assault, violence, or self-harm. Show extra sensitivity with difficult topics. Remind the person that what they tell you will remain confidential. Acknowledge that it may have been difficult for the person to disclose the information. For the sensitive topics or the difficult topics, make sure that you will keep the information confidential. And may have been very difficult for the person to disclose, as it is a very sensitive regarding the sexual violence or self-harm. They will not easily disclose the topic, so you have to be very sensitive about the topics, and you have to let them know that this topic should be kept confidential. The conversation between you and the person will be kept confidential, and you should not disclose to anyone. Experiencing depression can result in a lack of energy and not being able to sleep, feelings of being overwhelmed, difficulty with concentration or making decisions, negative thoughts and feelings of worthlessness, withdrawal from people and activities. When the person experiences depression, it can result in lack of energy, not being able to sleep, and feelings of being overwhelmed, difficulty concentrating or making decisions, negative thoughts and feelings of worthlessness, withdrawal from people and activities. This point, please note that down. That's why I am repeating 2 times. It is important what the person who are experiencing depression, what are the problems they face. Please note the points. And what are the do's and don'ts, we'll see in these points. Be patient and understanding. Offer encouragement and acknowledgements, no matter how small. Ask if there is anything you can do to help instead of asking what's wrong. Acknowledge that the mental health condition is not their fault. Speak clearly at a pace that they understand. Treat the person with respect and dignity. Continue to make positive suggestions. For better communication with the person who are experiencing depressions, the do's means the following points we have to keep in mind. How to start? First one is be patient and understanding. We have to be very patient and understanding their feelings. Second point is offer encouragement and acknowledgement, no matter how small may be. We have to give consistent support and understanding, and instead of asking what's wrong to the person, you have to approach in such a way that is there anything I can help? And we should acknowledge that the problem they are facing is not because of their fault. We have to speak to them in a very clear and concise way, and always we should use simple language and understanding language, and the person should be treated with respect and dignity. Violating their respect and dignity should be prohibited, and continue to make positive suggestions. Being they are in depressed mood, they are always pessimistic, but we have to try to bring them in a positive way by giving positive suggestions to them. Don'ts, that is the things we should be avoided while doing the conversation. Blame the person for the depression they experience. Think that they are not trying hard enough to get better. Assume that because they are having difficulty concentration, that they are unable to think clearly. For this depression, we should not blame the person who is experiencing depression, and we should not to treat them in a different way. We should not feel them that they are having depression. You are not wanted by the people around you, and we should not scold them. It's because of you yourself you are getting into this trouble. Instead of them, we have to help them to come out of the problem. Next, the most important part, that is the assessment principle of depression. First, I think we all know some tips regarding starting the conversation with the depressed person. That is, we have seen 6 tips for starting the communication. How to communicate with the person who are experiencing depression. We have discussed 6 tips. Please please read the tips carefully. It is very important because first is starting conversation. After starting only you came to know and you can assess depression. So please read the 6 tips carefully. Now we'll see the assessment principle. To start with the assessment principle, first it is very essential to know the common presentations of depression. I think it is repetition. We already have discussed in the previous class the common presentation. So just a quick recap of the common presentations of depression. The first one is multiple persistent physical symptoms with no clear cause, low energy, fatigue, sleep problems, persistent sadness or depressed mood, anxiety, loss of interest or pleasure in activities that are normally pleasurable. These are the common presentations of depression. Next is the assessment principle of depression. The first one is we have to be very thorough with the common presentations of depression. That is multiple persistent physical symptoms with no clear cause, low energy, fatigue, sleep problems, persistent sadness or depressed mood, anxiety, loss of interest or pleasure in all activities that are normally pleasurable. So, the first step is you have to think, does the person has depression? You have to think, does the person has depression? For that, you have to ask yourself, you have to assess yourself that has the person has at least one of the following core symptoms. We have discussed the core symptoms. There are 2 core symptoms. So you assess whether the patient had at least one of the following core symptoms of depression for at least 2 weeks. The first is persistent depressed mood or markedly diminished interest in or pleasure from all activities. And after you identifying the core symptoms, next is you have to check this again. Has the person had several symptoms of the following additional symptoms for at least 2 weeks? First, assessing the core symptoms, and then the additional symptoms we have to see whether they are present this additional symptom for at least 2 weeks. The additional symptoms are disturbed sleep or sleeping too much, significant change in appetite or weight decrease or increase, belief of worthlessness or excessive guilt, fatigue or loss of energy, reduced concentration, indecisiveness, observable agitation or physical restlessness, talking or moving slowly than usual, hopelessness, suicidal thoughts or acts. If all these additional symptoms is present, then you should ask or assess whether the person has considerable difficulty in daily functioning in the personal, family, social, educational, occupational or other areas. And in that case also, if the person is having or facing the problem in the family or in the social activities or in the educational area, occupation or any areas, then you can consider this as depression, and we can help them to go for counseling or any therapy for the interventional purpose. And if the additional symptoms is not present, it means that it may not be depression, as we have all said that no, all the symptoms does not amount to depression. We should keep in mind that all the symptoms does not amount to depression. If the person can control or manage by herself, it is quite good and well. So all the symptoms is not amount to depression also, we have to keep in mind. The second step for the principle of depression assessment is, are there possible explanations for the symptoms? Is this a physical condition that can resemble or exacerbate depression? Are there signs and symptoms suggesting anemia, malnutrition, hypothyroidism, mood changes from substance use and medication side effects? Example, mood changes from steroids. So the second step is we have to assess whether there is any other possible explanation for the symptoms. Like having any other physical symptom means like anemia, malnutrition, hypothyroidism, any drug addiction. It may be because of that the person may be feeling fatigue, then loss of energy, then not feeling to eat, appetite changes, and all this may be also the side effects of other physical conditions. So we have to be very careful in observing and assessing the person with depression. If the person does not have any physical possible symptoms, then we have to see whether there is any history of other psychological problems. If there is no, means we have to go for other psychological problems. If all this physical symptom is present, then the next step is managing that physical condition, whether it may be anemia, hypothyroidism, malnutrition. We have to go for that treatment, the interventional purpose for that. And even after getting the treatment for the physical symptoms, still the sign and symptom present means we have to start it whether it is because of the depression or not. If the depressive symptoms remain after treatment, means we have to go for other psychological examination again. If no means only with the treatment of the physical condition, the patient will get cured, will be recovered. See, next step, when the person has other psychological problems, then here we have to assess, is there a history of mania? Have several of the following symptoms occurred simultaneously, lasting for at least 1 week and severely enough to interfere significantly with work and social activities, or requiring hospitalization or confinement? If the person does not have any physical conditions, then we start assessing the presence of any other psychological conditions, and we have to check the following sign and symptoms is present or not for at least 1 week. The sign and symptoms are the elevation of mood and or irritability, decreased need for self, increased activity, feeling of increased energy, increased talkativeness or rapid speech, impulsive or reckless behavior, such as excessive spending, making important decisions without planning, and sexual indecision, loss of normal inhibition, resulting in inappropriate behaviors, being easily distracted, unrealistically inflated self-esteem. If all these symptoms is present for at least 1 week, then it may be because of the depression. And if it is does not present, means we have to see whether there is any major loss, bereavement within the last 6 months. If any loss from the family or anything lost, he considered as uh, very important, essential to him, or the loved or near ones, the person may experience such sign and symptom for few weeks or months, and it may go so. So it may not be depression, it will overcome with time. But still, such cases is not present, means the person has depression. All the sign and symptoms of psychological condition, we assess it, it is present. And if then depression is likely to be happen, and if the symptom present and any bereavement happens in the family, then it may be the cause for that changes in the person's mood. It may be recovered. So we have to be very clear about the assessment principle of depression. This is the third step. Next is the fourth. In the fourth steps, we have to see any of the following symptoms present, like it is confirmed that the person is having depression. So the next step is we'll see whether and the following symptoms are present or not. The symptoms includes suicidal ideation, belief of worthlessness, psychotic symptoms, talking or moving slowly than normal. If this symptom present, depression is likely. If not present, we have to ask whether the person has depression in the previous. If yes means depression is likely to occur. If no means we have to manage, we have to go for others. And we also will see whether there is any mental neurological symptoms or conditions present. And people with depression are at higher risk for most other mental neurological symptoms. So assess for the disorder due to substance use. Because of the substance use, like substance abuse, they may also show this symptom. So we have to be very thorough about the assessment principle of depression. When the person uses also, they can show this sign and symptom. So how to assess? What are the steps to be followed in assessing? We have to be very thorough about that. How long the symptom has to be present, and all these points we have to be noted carefully down, noted it and kept We will have discussion class when we come to face class. And please go through the assessment principle step and you can ask me if anything you can't understand. I hope students you all got some idea about this from today's class regarding the assessment of depression. The first point we have discussed is how to know that someone is experiencing depression and how the identifying the depression and communication tips. The most important part is communication tips because most of the people don't know how to start the conversation and how to approach the person who are experiencing depression. We have discussed 6 communication tips. Tip 1. Create an environment that facilitates open communication. Number 2. Involve the person. Third, start by listening. That is, be a good listener. Be attentive. Be empathic and sensitive. The fourth tip is be friendly, respectful and non-judgmental at all times. 5 is use good verbal communication skills. The fifth point is use good verbal communication skills. The last tip for good communication is respond with sensitivity when people discuss difficult experiences. Example, sexual assault, violence or self-harm. These are the 6 communication tips we have discussed in today's class. And lastly, the assessment principle. For this, the first and foremost thing is you all have to be very thorough about the common presentations of depression. The common presentations of depression. After knowing the common presentations only, we can move forward to the assessment principle of depression. So please students go through this principle of depression, the flowchart given by WHO module, and if you find any difficulty in understanding, you can come forward to me or you can call me at any time and you can clear the doubts. Thank you students, and I'll be uploading one role play. From that role play you have to identify what the students' problem are, that is your assignment. Thank you students for your active listening, kindly listening. Thank you once again. Bye bye.